Can you remember the last time that you or a loved one was sick? What would have happened if you hadn't been able to see a doctor? That's a reality for over 1 billion people worldwide. Every minute, a woman dies in childbirth or pregnancy. Millions of children die every year due to malnutrition. Millions die to HIV, TB, and malaria every year. But there's a solution. There's something that we can do. MedLife started when a friend asked me to do a favor. I was living in Ecuador volunteering at a hospital. Some friends asked me to take some school supplies to a small village. I took a bus, a truck, and hiked 5 hours into the Andes Mountains before I came to this small village and found a school there. We left those school supplies in that small village, but they asked us if we could do something more. They asked us if we could come back with a doctor. And so we went home, we got people to donate medications, we got people to donate funds, we found a volunteer doctor, and we went back to that village. On that trip, we met a young boy named Darwin, and he needed heart surgery. We didn't have any money, but we committed to his family that we were going to make that happen. We went home, and we stood in front of stores, and we asked people for spare change until we raised several $1,000s. And then we went back, and we got Darwin that surgery. And we haven't stopped since.
Groups of motivated students from around the world began to organize and fundraise one-week volunteer trips called mobile clinics to help extend basic healthcare coverage to the poorest of the poor.
They brought help in the form of doctors, gynecologists, pharmacists, and dentists to help alleviate the immediate suffering of these communities. But as we started spending more time with them, we realized that we needed to do more to alleviate the root causes of poverty and medical inequality. We got organized. We quickly grew across the entire country from New York to Los Angeles. We expanded outside of the United States to Canada, Puerto Rico, and the United Kingdom. We hired full-time, year-round employees in Latin America and Africa. We started new volunteer trips called Development Corps and mobile schools. We staffed our clinics with local doctors to provide culturally sensitive care. Now we deliver medicine, education, and development to 3 continents and have attended more than 100,000 patients.
Nuestro personal en Latinoamérica y África provee de todas las herramientas necesarias para que nuestros profesionales puedan diagnosticar las enfermedades y apoyar a los pacientes en el seguimiento a todo lo largo de su tratamiento. También trabajamos mano a mano con todas las comunidades y sus dirigentes mediante talleres educativos, proyectos de desarrollo, construyendo escaleras, haciendo baños o baterías sanitarias en las escuelas, construyendo casas y muchos proyectos más que estamos realizando y podemos realizar a futuro.
We're using our mobile clinics as a means to identify the underlying causes of community health problems. And through the MedLife Fund, we work together with communities and local governments to expand on existing infrastructure to reach a sustainable solution. When we're working with the poor, we listen to their concerns. We don't tell them what they need, they tell us. If a community says its greatest need is stairs to safely navigate a steep terrain, we build them stairs. If a community suffers from poor sanitation and widespread parasitic infections, we build them bathrooms. If children don't have a school to study in, we build them a school. When you make a donation to the MedLife Fund, 100% of that donation goes towards building medical clinics, schools, and other development projects for the poorest of the poor. After you donate, you can go to the website and see the photos and videos of our work, and read stories about the people that you're helping. When Darwin came home after his surgery, we met with his family, and his uncle asked us a favor. He said, "Please don't ever forget us." And we said, "How are we going to ever forget everything that's happened to us here in Ecuador? How are we going to forget Darwin?" And he said, "No, not Ecuador." He said, "Please don't ever forget all the poor people everywhere." Whether it's starting a MedLife chapter at your school, attending a mobile clinic, volunteering, providing educational materials, or making a small donation to our organization, regardless of how small, we invite you to join us to see how you can make a difference in the lives of the poor.